When a patient comes in for a tummy tuck or abdominoplasty, usually I'll sit down and have a lengthy discussion about what they want out of it. And also, a lot of things you need to take into account are their lifestyle, what if they work, what kind of work they do, because that affects the recovery as well. But generally speaking, there's three things to discuss when you're talking about the body shape around the abdomen. One is the skin, the looseness or sagginess of this. One is the amount of fat between that skin and the muscle, and the other is the amount of looseness of the muscle, how much that's been stretched out. Typical candidate for abdominoplasty is a mother who's had one or two children, and I see those quite frequently, and they have excellent results. However, we also will do abdominoplasties or tummy tucks on men and women who have not had children or just unsatisfied with their abdominal contour.
We've been very excited in our practice because we have found some ways to, number one, minimize the scar, and number two, minimize the post-op pain. First, concerning the incision, we have found ways to do extensive internal suturing such that in most cases, not all, but in most cases, instead of a wide scar, we are normally seeing an incision perhaps 2 millimeters to 3 millimeters wide. A fine scar at the lower abdomen that is hidden under a bathing suit, under underwear, with excellent contour improvements. To deal with the issue of the postoperative pain, we are doing extensive work at the time of surgery to put local anesthetics into the tissue. I would say we currently are having at least half and sometimes 80% of our patients get to recovery room with no pain. We are using an implantable pain pump that provides excellent pain relief for the first 3 to 5 days, which was always when the time was the most difficult for the patient. We have been able to convert our abdominoplasties because of this pain reduction to all outpatient because the pain relief has been so dramatic. And so we feel that we have been able to offer the procedure with a lot less pain, quicker recovery, and a lot less scars.